So this is the online workshop for neck and shoulder pain sufferers. And I thought I'd tell you a little bit about me. Of course, it doesn't want to. There we go. So um, my name is Stephanie Wiley Crowley. Some people know me as Stephanie Wiley. Some people know me as Stephanie Crowley. It's kind of what happens when you get married. Your name, you're just not sure what to go by. But I specialize in orthopedic and spine. I was a Division I collegiate athlete. I think that made me someone that was really interested in the body and how it works, and all that good stuff. And I've been a physical therapist for, gosh, 20 years. I don't feel like I'm that old to be out of school for that long. And then, yeah, the owner of Empower Physical Therapy. So today, what we're going to talk about is, why pain pills, medications, injections, and surgeries don't often work, and even get into like why even like massage therapy doesn't always work as well. Why MRIs and imaging leads us down a path to more unnecessary procedures, and what most of our healthcare providers miss in treating this area. It's really frustrating because you'll get people that'll come in and they've tried everything and nothing really has worked, and you just listen to their story and it's kind of like, golly, people are only looking at like the shoulder, or they're only looking at soft tissue, or they're only looking at strengthening, but they're not putting all the pieces together. And that's where we really come into play. So, how can we help? So, one of the biggest things that I always tell my patients is, where the side of the pain is often not where the source of the problem is. And so that's why people go, they have shoulder issues, they go right to their shoulder and they don't ever look at anything else. And that's a problem because often the problem is often in some other area. Not always, but 9 times out of 10 it is. And this is why, again, why people have so many frustrations to why they can't get help. And then I want you guys at the end to stay tuned because we have a very special offer on talking with one of our specialists for free and how you can kind of save some money. So some of the causes of neck and shoulder pain. So, a lot of this is, I always tell people we've got to start with the mobility first. We have decreased mobility in the neck. It could be decreased mobility in the thoracic spine. There can be decreased mobility in the shoulder, but we've got to address that piece of it. You can't go to a strengthening piece of it without addressing the mobility. And some of the causes, it's really common because, what do we do throughout most of our day? We're sitting in front of a computer, especially with COVID that has hit. We're in front of the computer even more. We're not out and about. And so we're always kind of looking down, not in the best posture, working. We get stressed, we get rounded out. We're on our computer all the time. And this is one of the biggest things that creates some of the problems, is that repeated motion that we always do. And I always like to equate it to like if you take your finger and you pull it back. If you pull your finger back and you hold it there day after day, year after year, year after year, our joints don't like being in those positions. And so it doesn't matter if you do injections, if you do soft tissue, if you do strengthening. It doesn't matter if you do any of those. If you don't fix pulling the finger back, you're going to continue to have the problem. And I equate this as kind of what we do is like, let's go have surgery, but we don't even know what you did or why you did it and how you got to be at this point in your life with all this pain. The surgery is not going to really help that piece of it. They're not going to give you the education of what you're doing in your lifestyle that's creating some of those problems. And you'll start having some of those problems again. And this is why one surgery often leads to another surgery, which leads to another surgery, because no one ever gets to the reason of why it's happening and get to the source of kind of the problem. So these repeated movements or these movement habits that we have, or these postural habits that we have, if we're moving the same way day after day or staying in the same posture day after day, it creates problems within our joints, and we've got to address those problems. And so often what people want to do is they have tightness in that shoulder, they have tightness in the neck, and they want to just stretch that muscle tightness. Well, that muscle tightness is a symptom. And that symptom, it won't, like, that's just like same thing with like massage. You have some of the tightness, you go get a massage, it feels good. An hour later, a day later, all of that pain comes back again because you're treating a symptom. And that's kind of what happens in our healthcare system. And when you can get to the source of everything, you'll be surprised at how quickly things can resolve. Just like muscle tightness between the shoulder blade, again, it's a symptom. And you're going to hear some stories down the road of some patients that had, very similar symptoms of this and how we were able to kind of resolve it. But these are kind of the causes, are our movement habits, our posture habits, and you have to treat the mobility piece of it first, improving the range of motion within the joints, whether it's the neck, the thoracic spine, or the shoulder, before you can even get into any kind of strengthening, which is kind of like phase 2 of it, and then undoing some of those movement habits or why this is happening. Addressing that piece of it so that we really can empower you to really understand what you're doing, so that you're going to now know how to take care of this and resolve this on your own if it does come back. So the anatomy, why neck issues create shoulder issues. So you can see in this picture, we have our shoulder blades here, and we have, our ribs that kind of come through here. And what tends to happen is, especially like, one of the biggest areas that we have problems is like in the neck is C5, C6, C7. And if you go and you take and you sit up in a nice, good posture, and then you slouch, guess where you slouch at? Guess where that head like bends from it in that forward position? It bends from C5, C6, C7. And that's why those areas are the most common areas. So if you think about it, that's probably like, right in through here. Well, if you aren't moving there, then even like with that rib function, if that ribs go and they kind of get stuck kind of outward a little bit, our shoulder blade has to glide across those ribs. And if they can't glide across those ribs, then you're going to have a hard time raising that shoulder. And this is why I'd say, like, oh my gosh, I don't know how many people come in with shoulder issues. I'd say, upwards of 60% of our shoulder issues actually are coming from the neck or the thoracic spine. And no one ever addresses that piece of it. We had a patient that literally, she did stem cell in her shoulder, injections in her shoulder, PT in her shoulder, and nothing was getting better. And the doctor went and did an MRI and said, well, we need to go and fix this rotator cuff. Had rotator cuff surgery. 6 months later, she is still hurting, still having a hard time moving her arm, can't do anything. And literally, I've been talking to her. I begged her not to have the surgery, but she still had the surgery, still followed up with her. And when I called her, she had said that she still was, having issues. And I said, well, when you hit your low point, call us, because there's something that there's one of two things that's being missed here. And when she came in, eventually, because she called us like almost 2 weeks later, when she came in, she literally, like, her range of motion in her neck wasn't that bad, didn't have very many issues, like didn't have a lot of tightness between her shoulder blade. It was literally in her shoulder, but she had so many issues of just lifting her shoulder. It took her like an hour just to warm up her shoulder in the morning to get dressed to be able to go to work. Like, she literally was just functioning to go to work. And I know a lot of you out there can feel that same way, because that's a common thing that we hear. And so I just was like, we have to rule out your neck. No one else has. We have to do this. And sure enough, we started ruling out her neck. And even within the first visit, I mean, her range of motion improved by like 80%. Now, she still was in some pain, but her range of motion improved. And with that range of motion improvement, her pain levels started reducing. And I mean, she was able to start functioning in 2 to 3 weeks when she's been having years of pain. Now, she wasn't better in 2 to 3 weeks. She just was improving so much that she was very happy with her progress. And then we were able to progress her then. So it was, maybe an 8-week, 9-week process. But, over that period of time, she got her life back. And that's what people aren't missing. And there's a lot of shoulder issues that we've even missed initially, when I was like, God, we've ruled out the neck and we've gone to the shoulder, and it was in the thoracic spine. And so now we hit the neck, then we go to the thoracic spine, and then we go to the shoulder. And when we go through our evaluation process like this, then we don't miss anything. And we really can get to the source of what's going on fairly quickly. I always tell people it may take us 1 to 3 visits to kind of figure things out. often we figure things out in the first visit, but sometimes, it can take a little bit longer as we're ruling things out. So why do medications, injections not work? We feel pain in three ways. We feel pain mechanically, and we're going to talk about that. We feel pain thermally, we feel pain chemically. And then the other ways that we feel pain that we also look into, just in case if some of these aren't really fitting the picture, there's autoimmune issues that people have that can create pain, but they present very differently. Then we know where to get people to go to when they need help with that. And there's also emotional pain. Anytime that you have, like, I'm not talking, oh, I had a bad day. I'm talking, this is that chronic emotional state. Anytime you're in one of these states, your body's gonna feel it at the weakest link. And so if you have pain in a certain area, you can have pieces where the emotional component is a part of it that needs to be addressed. And this is where I'm talking about, like, we have to get to the source of the problem. Going and doing pain pills when something is emotional doesn't work. Doing pain pills when something's mechanical doesn't work. And this is why a lot of times when you're like, well, it helped for a little bit and then it came back again, or it didn't help at all. We hear this a lot. And then they get a second injection and it still doesn't help. And so when we look at the mechanical pain, that's our mechanics. That's how we move. That's how our joints are moving. And most of mechanical pain can be resolved if you find the right person that can help you. It's like finding a good car mechanic. You can go, this is how I equate our healthcare system. You go to the car shop and they want to hook it up to a machine and it spits out 7 different things that's wrong with your car, but not all 7 things are wrong with your car. But they want to go fix all of it. Like, that's our healthcare system. You go and you get to a good mechanic and the mechanic goes, oh, it's either this or this. So let me go look at this. Let me go look at this, and they can fix the car. Well, that's what happens when you get to a good mechanic of the body, because we can basically go, okay, let's start ruling things out. Let's see how things move. And we can really get to the source of the problem. We don't need all the imaging and the testing and all that kind of stuff, not unless there's some red flags out there, which we do. We know what to look for on those. And we actually almost can catch them better than some of the doctors because we can spend more time with you. So that's like the mechanical pain. Thermal pain would be like burn, sunburn, so we can kind of take those off the plate. Chemical pain is like that. You have this injury and it's you have that throbbing, aching, like inflamed joint type thing. It's constant pain. Chemical pain is always constant pain. You can't change your position or do anything to make it better or worse. It's truly like that inflammatory response. Now, chemicals can treat chemicals. And so if you really truly have an inflammatory response, and we've sent people to say, like, okay, it's so inflamed, we can't do that much with you. So yeah, let's go ahead and get an injection, but come right back in, and then we can start moving you more, and hopefully we can progress you faster. Now, we've had to talk to people about that before. It's rare. Usually you don't. When you ask questions like, can you change your position and make it better or worse? Yes. That's not chemical pain. That's mechanical pain. Does your pain come and go? Yes. That's mechanical pain. That's not chemical pain. So just even asking a few questions, we can really determine if a drug's going to help you or not. It doesn't take rocket science if you really understand how the body works. And so that's where, coming in and talking with us, we can really hone in with the questions, because we spend time with you asking a lot of questions to get an understanding of how your body works. And then basically we're like, okay, we think it could be this or this. And then we basically are running our own kind of hypothesis, I would say, to figuring out, like, yes, that's what it is, and it's not this, and ruling things out. But that's, why medications, injections don't always work. Because again, you got to get to the source of the problem. And often it's not a chemical problem. It's a mechanical problem that needs to be addressed. So why does surgery lead down to more frustrations? And kind of what does the research tell us? When you look at surgeries, again, like that same person that we talked about earlier, she had a rotator cuff MRI showed a rotator cuff tear, and she had tried everything else, didn't want to have surgery, and then she did have surgery. The problem was it was the wrong body part. So even when you go in, and I know we'll get into imaging here shortly, even when you go into imaging, imaging doesn't always tell us the picture. And we'll talk about some of the research on what that what it shows like in general, and you'll be like shocked. You won't want to get an MRI and spend $1,500 on an MRI when I finish telling you what the research shows on it. But yeah, why surgery leads to other frustrations is because again, you got to get to the source of the problem, and you've got to get into like, why is this happening? If we can't get into like what you're doing throughout the day that's creating some of these problems, guess what? You're going to have the surgery and you're going to go right back into those same positions, postures, things that you did throughout the day. And then all of a sudden, a year later, you've been feeling great and then you hurt again. And no one gets into like the what you're doing throughout the day. I also often like equate it to like heart disease. We have heart disease and we have plaque in our arteries, and what we do is we bypass that, and so you have bypass surgery, but they don't ever fix anything that they did that created that plaque in their arteries, so it comes right back again, which is kind of stupid. So it's the same kind of philosophy. We've got to get into why or what you are doing throughout the day that's creating some of these problems so that you don't continue to go down this bad path. And some of it is just saying, okay, you have a sitting job, so let's come up with some solutions for you. Let's come up with, how we sit. Can we use a lumbar support so that we can have better support with our positioning? Can we do things like have a standing desk so we can stand and work? Can we do some exercises that offset some of the motion that you're doing? If we're always kind of looking down, there's exercises that we can show you to go back and take the motion in the opposite direction to keep that joint flexible, essentially. So there can be tools that we can show you to help you. We had a couple of dentists in like about a year ago, and their whole big thing was they want to be able to work. They were already hurting at a young age, and they're over in weird positions over their patients. They're like, I want to be able to work until I'm like 60, and I'm not going to be able to continue to do this if I'm hurting at this young age. And so we literally went to the office and sat with them and adjusted how they did everything. So on top of treating them and fixing them and getting them back to feeling really good, but they now have those tools of how they're working and how they adjusted their chairs, what new chairs they bought so that they can be in a better position. And now they know how to manage everything, and they're doing fantastic. But that's the thing. You've got to get into what they're doing throughout the day that's creating some of the problems. And if you don't address that, you're always going to have problems, which is why surgery doesn't always work. So MRIs, again, why do these lead to more procedures? So MRIs, when you look at the research on MRIs, it's not great. And when I was getting all my training through the McKinsey Institute, getting my diploma, and part of getting that diploma, we had to read a ton of research. I mean, I have research like stacked high. And when I was going through and actually reading some of the research, we had to read so many different things, bring a lot of different theories, comparing them. And one of them was like MRIs. And I literally was reading research after research after research. And I was like, oh my God, they all say the same thing. Literally, like if you took 100 people with no pain whatsoever, 60 to 80% of them are going to show something. And that's with no pain whatsoever. So if you're having pain and it's in the shoulder and they image it, I guarantee you they may be finding something in that shoulder, because that's just what happens. And so again, are you sure it's really coming from the shoulder, or is there something else that's going on that's creating some of that shoulder pain? So, you can have rotator cuff tears. Like there's research with baseball players, and they are still pitching. And if you look at all the pitchers for baseball players, I would say 90% of them have rotator cuff tears, yet they're able to pitch and throw at such a high velocity. So, you can have people that have degenerative changes, herniated discs, facet issues. I mean, you name it, meniscal tears, labral tears, all these things you can show up on MRIs, but they may not be what's going on. It may be something that just happens, and why it's like 60 to 80 is like the older that you get, the more likely it's going to show something. It's kind of like, the older we get, the more wrinkles that we start getting on our face. Now, I know that we don't want those wrinkles on our face, and we'd love to do surgery for those, but they aren't damaging or hurting or anything like to our body. Like it's just what happens as we age. Well, some of the things that we're finding on imaging is just it's just the aging process in our body, which is why we're seeing people that have no pain whatsoever having issues with imaging. So that's another thing. A lot of times I'll tell people, if you're going to get an MRI, how is it going to change your decision and what you're going to do? So, for instance, if you're getting an MRI because the doctor doesn't know which surgery he needs to do, and he thinks that there's an ACL tear, let's just go with that, and he just wants to make sure, well, great, you get an imaging because that's going to determine whether you really, really, truly are going to have surgery or not have surgery. Like there's a decision to be made. But if it's I'm not really sure what's going on, let's just take a look. But we're going to be conservative. Well, you're just wasting your money on the imaging. It's not going to tell you anything. It's like, going and taking a picture. It's a picture of your body when you're lying down. We hurt when we're sitting up, moving around, doing all these things. It's usually not when we're moving, when we don't hurt. Now we can hurt when we're not moving, but um, it'd be like taking a picture of like a telephone. You take a picture of a telephone, but you can't see in that picture. Is it plugged into the wall? Is there service? Is there something wrong with like the phone itself? Like, does it need new batteries? Like, there's so many things that could be going wrong with that phone, but you can't see that in a picture. And it's very similar with imaging. So, what do other healthcare providers miss? So, a big one, like I talked about this earlier, lifestyle changes, posture habits. These are things that we need to address. We need to come up with a game plan for you so that if you do have, a sitting job, or if you are wanting to get back to being active, then we have a game plan on how to do that safely so that you really empowered to know how to take care of yourself. It's not you just have to come in for the rest of your life. We're going to go in and crack your back and then you're good to go, but you're going to come back in next month. No, a lot of it is we're teaching you what you need to do, taking you through the process. We're like the coach of your body. That's essentially what we do. But we can spend time with you to figure all those things out. Where a lot of times, you go to doctor's offices, you're in and out of the office in like 5 minutes. Sometimes I'll give you blanketed exercises when I'm like, how do you even know that that's what's going on when you did like a 5-minute assessment? You go to other physical therapy offices and there's 2 or 3 patients in the office at the same time. They just don't have time to spend time with you. And, we've had several patients come in just recently, even complaining about, they just gave me the same things over and over again. They didn't listen to me. They didn't make any changes. I actually hurt worse. And they said, pretty much, we're done. Like, I can't help you. Like, they didn't even try. And we see this. I've had patients say like they feel like, when they go to other places, they get to like maybe the 30-yard line, but they never get to the end zone with them because they aren't listening to come up with a different game plan to really help them. They tend to do the same things over and over again. So the other problems with healthcare providers is they look at the side of the pain. I do not know how many times this happened. You have shoulder pain that's in the deltoid area, common area that's not always coming from the shoulder. A lot of times it comes from the back or the thoracic spine, and then they're scraping down that one part of the arm. But they're not looking at the whole big picture. Like, why is it tight there? You've got to figure out the why. And then they only look at the injury one way. And I talked about this earlier too. You go to a massage therapist and they only look at the tissue. They're only doing strengthening. They're only doing injections. They're not really sitting down and putting everything together. We do, we've got to get the mobility back. And sometimes that mobility is doing, soft tissue to improve that mobility, which will keep some of that soft tissue from tightening back up again. You've got to improve that mobility is key. And then you've got to work on the strengthening piece of it so that when everything is moving correctly, we've got to get your body moving where you're not doing any kind of like, bad habits or bad movement patterns that we need to address to get you back. Or getting you back to whatever it is, a sport, biking, running, whatever that is, walking safely so that you know how to do it. When you go and do a training program, let's say you're going to go do a training program for a marathon. You don't just go, okay, I'm just going to go out and run and see how it goes. No, you have a specific training schedule so that your body can tolerate to getting back to some of those activities. It's the same thing. We're going to give you a specific training schedule essentially to get you back to all the things that you want to be able to do and doing it safely and understanding, how the body responds. We always tell people we want to know what happens during, after, and the next day when we get you doing some things so that we know how the body responds and we know how to adjust it based on that. And a lot of times what patients will tell us too is they don't say it in any other words, but when we start talking about it, they feel like they're on a hamster wheel, like they're just going and going and nothing is really helping and no one puts it together for them. That's a common theme that we see. So here's a patient. I just interviewed her, and literally, she had rotator cuff surgery scheduled, and luckily we had talked before then, and she literally, like, she was able to cancel it. She canceled it within 3 weeks of coming in here. So here's her story.
Okay, so we have Stacy. She's one of our past patients, and I really wanted her to kind of share her story, because if anyone's ever followed me with anything that I say, I always tell people where the side of the pain is often not where the source of the problem is. So Stacy, tell us a little bit about kind of, yeah, what happened when you. Started hurting and everything.
Sure. So about 1.5 years ago, I realized I could not raise my arm above my shoulder. So I couldn't do this. And I wasn't really quite sure what was causing it. I mean, it was probably because I sit at a desk all day, doing CAD work and, sitting there mousing all day long. And then I noticed, I kind of remember getting a kink in my neck at one point, and then it seemed like it got worse following that. So I think it was just a combination of things, and over maybe several months or even a year, it just sort of got worse and worse. So I decided I would go see a doctor. So I went to an orthopedic surgeon. So I went back to him. He gave me a cortisone shot, I think, and that didn't work either. And so then I continued with that therapy that didn't really do much. And eventually he suggested that I have surgery because I had a tear. I had a tear in my shoulder.
Yeah, I think you got an MRI and it showed a tear, and and then around that same time, probably a month before that surgery, we started talking. And I was like, what did you do? Did you fall? Did you do anything? And you're like, no, it just really came on. And I was like, okay, that doesn't really make sense. And I started asking more questions. And
so that made me start thinking, well, maybe I shouldn't do that, because that's very extreme. And I know my mother-in-law had surgery on her shoulder, and she was miserable for months and had to sleep sitting up. And so that just sounded awful. So thankfully I happened to talk to you, and you said, no, well, why don't you just come in and see me? So I came in to see you, and so I mean, the first thing you had me do, from what I remember, it's been a while now, you laid me down on like one of those rollers, and I just kind of laid there like, back.
Yeah.
And I'm like, wow, that's really tight. And so I continued to do that, and that seemed to kind of loosen things up, immediately. So,
when you were talking about how you didn't really know what you did, I'm like, well, that's just really odd. And then I started asking, like, are you noticing anything like in your neck, in between your shoulders? You're like, well, actually, it kind of started there. And I'm like, oh my gosh, no, you have got to come in. And then that's when you came in. And a lot of people don't even think to look at the neck or even the thoracic spine for some of these things. And I know I pretty much said, like, did they give you like rotator cuff and rows? You're like, yeah, that's exactly what they gave me. I'm like, yeah, that's why it didn't work.
Right. I probably just irritated it more.
Well, it probably did, because again, it's like a lot of times you go to places and all they want to do is like, oh, it's rotator cuff. Okay, so they don't investigate, they don't ask questions, they just go, okay, it's rotator cuff. This is the cookie cutter thing that we need to do for the rotator cuff, and that's what happens. And so that's when I was like, no. And there's so many, our shoulder blade has to like glide, through the ribs. Like the ribs have to be able to move, and if they don't, then you don't get that shoulder blade connection very good, and it can affect you even lifting your shoulder. And I know that like we didn't even touch your shoulder. I don't even think we gave you shoulder exercises. And it like completely resolved when we did all the back stuff. And I can tell you, like what you were telling before, oh my gosh, rotator cuff surgery is not something you want to do. Yeah. It's probably one of the worst surgeries because it's a 6-month ordeal. I mean, you're literally, you would have had to have bought like a recliner because you can't sleep in bed because it hurts so much and you don't get sleep and it's so hard to function. So yeah, I mean, you went from like potentially a 6-month issue to a 6-week issue.
Right. And then I just continue to do those exercises and everything seems to be fine. I mean, I still have a little bit of kind of pain, a little achy pain, but it's nothing like it was where I couldn't raise my arm, you know. And when I have a little bit of pain, it's most of the time it's because I've been sitting at my desk all day.
Yes. And then you just go back to doing the stretches and it goes away like that.
Right.
And that's ultimately, I mean, that's the reason why most people get their pains. Honestly, it's the sitting. Like sitting is like worse than like smoking and drinking and all that kind of stuff. Like it is so bad for us, and that's what we do all the time. And that's why it'll kind of slowly kind of come back. But if you go into the exercises, it stays away, and you know exactly what to do.
Yeah. So. Yeah, it's so much better, and I'm just grateful I did not go through with the surgery, and so what you recommended definitely worked. And
I'm so glad that you're able to share your story because I know there's so many people out there that potentially are going down that same path. And there's times, I mean, we're not totally against surgery. I mean, there's times when surgery is needed, and we've told people like, I agree. I think surgery is needed, but I would say, more times than not, it's not needed. Like there's so many, our body has an amazing ability to heal if we know what to do and where the source is coming from. And that's kind of what we do. So thank you so much.
You're welcome.
So what do we take from this? Most of our injuries do not require surgery or medications. We have saved a lot of people from neck and shoulder surgeries. And I can tell you, like, our office has been open crazy. It's almost been open 4 years. It'll be 4 years in June. And I can count on my hands how many people we've sent to surgery. And that's, from back, neck, shoulder, knee, hip, you name it. Because if you can really spend the time to kind of figure things out, you can avoid a lot of things out there. Most of the time, no one gets to the source of your problem, which is ultimately why everything is kind of happening and why you're not getting resolution. When I say, that when people come into our office, they've tried everything. They have, like, that's the typical patient that we get in, are people that have tried everything and nothing has really worked, or it's worked a little bit and they still can't get back to whatever it is that they want to get back to as far as living their life. MRIs and x-rays do not help in guiding treatment and resolving neck and shoulder pain. And seeing a specialist will help you figure things out faster. It's kind of like you have that coach so that you can get to your goals faster. Think of us as that coach. You go and you want to Google stuff and try some stretches and try this and that. And you go onto Facebook and what can I do for this injury? And you have all these people that give you all these suggestions. It just may not be the right thing for you. And I'm telling you, you'll save a whole heck of a lot more time and money coming in, figuring out, coming into the right person to help guide you through that process than trying it on your own. And at some point, life is too short to be hurting and not being able to do the things that we love to do. And really, I just want to give you hope that that you can get back to living your life again, that you can do what you love to do. We've seen it time and time again for people, and sometimes we have to make modifications, but they're able to kind of get back. And that's really what we love to do. I mean, that's why we do what we do, is just seeing the progress and seeing people that didn't think that they could do it actually get back doing what they love. So we have several kind of special offers for you. So one is if you talk to, we have a thing called Free Discovery Visit, where you can come and sit down and talk to us, regardless if you want to come here or not. Like, you can just come here so that we can help you make a better decision about your health. I almost say like that's kind of like your second opinion per se, or maybe your third, fourth, or fifth, as most people go through it. But we can really sit down and talk and just make sure that, yes, we've seen this before. We can help you. or just help you figure out kind of what your next steps might be. We have that for you. And then if you come in the next 15 days and do a full evaluation, and you can do the discovery visit before then, we're going to take $100 off the evaluation price too, just for the people that are actually on this online course. So here's another success story. So this was a client of ours that was a 52-year-old male, and he was having difficulty throwing the baseball to his sons. And you know, he also was affecting him, you know, doing push-ups or pushing up off the floor. And so he just was really fearful that he just wasn't really going to be able to play ball with his kids. And that's like what he loved to do. And that's what his kids love to do. And he wanted to be able to do that. And, you know, he came in, he had tried some other physical therapy offices, obviously, and he was frustrated that that he wasn't getting any better, which is what a common thing that we hear. He was just given some exercises for the shoulder. And basically they left him alone for treatment for like half the treatment. So he kind of was coming in doing the same things over and over again, not really getting any better. So he was really skeptical coming in at first because, like, you know, they've tried physical therapy. How are we different? But within the first visit, he really knew that it was a different place. And, you know, we first had to kind of rule out his neck, and that didn't really change anything. And then we went into that thoracic spine, and that's when we made some big progress with his shoulder range of motion. And then once we got that moving a little bit better, then we started going and training him back into being able to throw. And now he's throwing pain-free and able to play with his kids, which is pretty fantastic. So again, want to give you several options. You can talk to us, free discovery visit. You should be getting an email that should probably come around 6 o'clock or so that you can actually click on a link to sign up for this so that we can get you in. And then there also will be a link. We've done a tips report. It's on our neck and shoulder tips, like my top tips for neck and shoulder. So we have that too, where you can click on the link, sign up for that as well. But that should be coming in an email. If you don't get that email, please get a hold of us. And then if you come in for that full evaluation, that you want to do that in the next 15 days, we're going to take $100 off that evaluation price for you, so that we can, you know, still sit down with that discovery visit, but dive in a little bit deeper to kind of figure out what's going on with you. So that is it. Do we have any questions? And I figured out my audio problem.
Of course, no one now's going to talk to you.
Oh, I know that it happens all the time. I usually get questions for before these, but no one really had that many questions. And I think I know addressed. One was a posture question. I know I addressed that. I think I got that taken care of. Well, David, how are you feeling?
I was just going to say that I don't have questions because I actually went in and got my questions answered.
Yeah.
And it still hurts, but when I stretch, it is tolerable.
Yeah.
And so it went in the right direction.
Yes.
So that was good.
Yeah.
So my issue was, for everyone else watching, I had horrible pain in my arm, and I wasn't sure if it was a disc or pinched nerve or what. And so, just as Stephanie said, I talked to her for 30 minutes. She said, it sounds like this. You sit all day, and look at my perfect posture now. So she gave me some exercises to try to undo it, and I do it like a minute for each exercise. I can't even do a minute half the time because I can't go that far yet. But it relieves the ache out of my arm. And so we think it's kind of a disc issue.
Yeah. It's a disc pinching a nerve a little bit, but they're totally fixable. And you know, it's kind of like, you know, having a scratch on your arm, and when it's really irritated, you know, we're just taking the pressure off. Like stabbing the arm will keep it irritated. That's what we do throughout the day. Is we don't know what we do that's creating some of our problems. So we're stabbing the wound. And when we give you exercises, we're basically taking the pressure off the wound so it can feel better. And so when you do that, it feels better, but it takes time to heal. And then as we progress the exercises to go farther and farther and farther to where it gets better and better and better till it's gone and you know what to do.
Yeah. And as I said, I was just coming to this to get educated, but the pains got too bad. I said, screw it, I'm going in to see her anyway. And
plan.
it's moving in the right direction, so that's good.
Yeah, and that's just the first visit.
Yep. Yep.
Mona, do you have any questions?
I don't
No.
think so.
Your shoulder is a completely different ballpark. I mean,
It's awful.
yes, I 100% agree.
Yeah.
Mona basically fell and injured her shoulder, and when she had surgery, like it wasn't taking with her bone, so she doesn't have anything to connect anything to, essentially. So
Ouch.
how many surgeries have you had?
8.
8.
Wow.
The last 2, they took the muscle out of my back and tried to cover up the hardware for the acromion, and it failed. And then the 8th surgery, they tried to move the muscle back over it again, and it failed again. So right now I'm in the sling indefinitely to keep
Yeah.
the hardware from coming out of my skin.
Yeah,
Oh my gosh.
her arm just gets distracted essentially, and it's pulled everything out.
My
It's
deltoid is like down to here. It's
yeah.
awful.
So like normally we have a little space here where our arm is, and we shouldn't have much of a space, but it's like she could probably put like 3 fingers, and that's where her arm socket is.
Wow.
It's
yeah.
crazy.
No kidding.
But her office is wonderful. They figured out the first surgery I had was done wrong. The pins were put in the wrong place, and they sent me to a wonderful surgeon.
Yeah.
And then I just kept breaking it because he said my bones are like potato chips.
Yeah. Yeah.
But yeah,
Marla, do you have any questions? And you can type into the chat too.
Yeah, no, sorry. I just had to unmute myself. No questions. I just probably sports, and then long, where I used my shoulder a lot, like volleyball and tennis.
Yeah.
And then the last 30 years, just sitting on my butt at my desk for far too long during the day. I'm a CPA. So,
You're in the thick of it.
I've been told my core is weak and my hamstrings are tight. So I don't know. We'll see. You can tell me your own opinions when I come in.
Exactly. I'm not a big the core thing is for me, like, yeah, core strengthening is important, but it doesn't fix anything. And ultimately, if you're sitting slouched, it's not because of the core. It's just because even if you have the strongest core, no one's going to sit in the best posture and hold that posture while you're working really hard, throughout the majority of the day. So, so the core doesn't make a big difference. And hamstrings, man, sometimes hamstrings a lot of times can happen from like tightness in hips. It can also happen coming from the back. Like I've had numerous times where we didn't even touch the hamstring, and we addressed like it was either a back issue or it was a hip issue, and we addressed those issues, and then the hamstring just like resolved and the tightness went away. So
well, now that you say hips, that has sort of come into the fold especially the last year.
Yeah.
Because I used to go out and at least I'd walk to my car and into the client or to see people. And now I walk into the next room. So, hips have kind of, now when you say that, they've definitely are just super painful and tight and have come into the fold in recent years. So it will be interesting to see and hopefully get some kind of relief.
Oh yeah, no, we see stuff like that all the time. Like you are not alone in that. Just ask Lauren. She had the same thing. With her back and hip. Yeah.
Oh, right. Yeah.
Yeah. Same thing. And then same thing with the neck. Like she also had the thing where, her shoulder was hurting. She went to a chiropractor and they were scraping her shoulder. And I'm like, they didn't even address the neck. And it was all 100% a neck issue.
Oh, interesting. Yeah.
So she drove down and she's like, never again. I'm just going to go and see you because I know you're going to fix it. And because it actually made it worse. She got worse.
Yeah, she was in pretty bad pain
She
for a while.
was.
Yeah, when you said Lauren, I looked around, I said, I don't see a Lauren on the call. And I'm like, oh, Lauren, my friend Lauren.
Well, awesome. Well, I am going to end it. And like I said, you should get emails too for if you want to set up a discovery visit and or the evaluation. And we can even do the discovery visit virtual if we need to as well, if it's just like schedules are crazy and all that kind of stuff. So we can at least get the process started.